unusual to be quite tender just above the belly button after this?
Or around.
No, most people are perfectly okay with having their innards poked hard for 30, 40 minutes. It's, my guess is there's...
I assume this is something you do, and then you give it a period of time of rest for everything to settle, and then you do it again.
How sick is your person?
Sorry?
How sick is your person? Okay? Today, you're going to be really sore from yesterday. And then if we can get ahead of the cycle where you were to do it every day, there'd be a point where in a day or two, you'd be really not looking forward to it. And then your body will suddenly shift, and that's when the chi really makes profound differences. It's a little bit like getting real foot massage, not like the fun foot massage that you get in China, but a real foot reflexology, done well treatment that's done therapeutically, which means it's not necessarily very pleasant. And then you do it every day, not you go and you get a nice foot massage. And it's about the day 4 or day 5 that when you really have had I talk about how real healing only happens not when you get rest, but when you rest upon being rested. Okay? Because when you rest, all you did is rest the fatigue. But if you plan to do some deep healing inside, once you're rested, then everything you rest after that has a chance to do some real healing. For something like this massage or real foot reflexology or any of those things, then it's not the fact that you got massaged and are tender, but it's the tender spots being massaged. Does that make sense? So you have one where rest upon rest equals one thing, and then it's the Tai Chi, so there has to be pain upon pain equals something else. And so you massage the spot and they go, oh, that's tender. And that's tender, and then they come back in the next day, and you're massaging what's been woken up and enlivened. The chi is like, whoa. And it's a little bit dispersing to disperse if you're not careful, and so you need to be careful who you're doing that kind of treatment style to. But if you can go on it such that you are treating the pain spots that are painful, that are now more painful with the treatments, day 4 or 5, it's no longer painful, and they'll often have, if they're doing the foot reflexology, this incredible urination. Like, it smells, it's cloudy, it's all this stuff comes out through the urine that takes that building that a foot massage once a week or twice a week isn't going to do, and a pleasure foot massage isn't going to do. With this, there are times when you have the nice bowel movement, the person passes gas, that's all nice, but if you're working on this on someone who really needs it, then about the 4th or 5th treatment, if you can make them pretty sequentially every day or every other day, they can have a pretty dramatic clearing. And I don't mean like they sit on the john all day long, but what comes out is just a little scary. It's like, and then you realize just what we're living with inside ourselves. But that's not to be done to all people in all circumstances, and that's not the treatment style. This is not what you do. Okay? It is one way of applying this to a patient base that fits the chi blood profile that would benefit from that kind of direct treatment. Otherwise, you would let it rest and go again. But do remember that I do 100% believe that many illnesses can be cured. It's a question of contact hours. How many contact hours is it going to take to cure this disease? And if it's, say, we'll make up a number, 11 contact hours, and you see them 1 hour a week, that's 11 weeks. And in between those 6 days on the one time you see them, they can get sick, they can have all sorts of things happen that ruin the 11 hours. But if a person comes in and gets treated for an hour and a half in the morning and an hour and a half in the evening, that's 3 hours. And by the end of a week, they've had more than 11 hours of treatment. Can you see what I'm trying to get at? Now, not all things are that easy. Some illnesses, you can't just add up the hours, do it all in one day, and they're miraculously better. For certain physical injuries, they need that 72-hour reset, all of those things. For certain other illnesses, it requires that they sleep, and the body has to go through a 24-hour cycle of awake and sleep. Just like illnesses can flare in the seasons. So someone has allergies in the fall, and you do a great treatment, and their allergies are gone. They say, this has never happened to me before. I'm not sneezing, I'm not stuffed up, I don't have headaches, and they're so excited. And then they hit winter, and their allergies come back. Or they hit spring, and their allergies come back. And it didn't come back. It is their body's response to spring, and you'd fix their body's response to fall. Because remember, the 4 seasons have a great influence on us in terms of chi. And so their body gets into it gets into fall and responds flaring what we call allergies, and we balance that with the fall. We balanced their qi with the fall. We didn't fix their allergies. Okay? And then the clock moves to winter, and maybe they have the winter problems that flare. We have to balance their body with winter. And then it hits spring, and we balance their body with spring. And then, so I'll tell patients who've had long-term allergies, things like that, that I expect that they'll need 5 seasons of treatment. And it doesn't mean they have to be treated the whole time, but we have to, in every season, make sure that they don't flare. And if we can stop their flaring in every season as it happens, by the time they get to the 5th season, we're treating them so they go through a season with no flare at all. And if that happens, then we can pretty much be sure we've taken care of their allergies.